Coming up next, licensed insurance agent and Medicare specialist Mark Brownstein hosts his monthly educational segment, Medicare Mark on the Air. Tune in for guidance, special guest interviews, and valuable information on all things Medicare.
Good morning. Good afternoon. Good afternoon, WVOX listeners. This is Mark Brownstein with Emerald Medicare. Welcome back to my monthly radio show. It's so nice to be here again. I'm with a very special colleague, Mike Civitano, who's joining me here today. Welcome, Michael.
Good morning, Mark. How you doing? Thanks so much for having me.
Good. It's so nice to have you here today. Michael and I work very hard at Emerald Medicare every day, supporting clients. And usually I have a guest that is helping people in some fashion of senior care. Today, Michael and I are going to talk about Emerald Medicare, which is not something I usually do. And we are quite proud of what we do at Emerald Medicare. We have an office in Stony Point, New York, and Nyack, New York, but I travel Westchester, Connecticut, New York City, Long Island, New Jersey, Connecticut, Pennsylvania, Massachusetts, for financial planners, for CPAs, for veterans, for so many different kinds of people who look to become educated on Medicare. We are at 845-358-1220, and our website is emeraldmedicare.com. Please look at it, and please sign up for one of our webinars or seminars. So, Michael, welcome back to the radio with me.
Yes, it's been a while. I think the last time I was on the radio show was back in 2020 or 2021, so it's definitely good to be back. I love appearing on WVOX, and I think that this is my first time, but the last one was with WRCR, right?
That's correct, in Rockland County. So, yes, folks, I have two radio shows, and I'm always educating people on senior issues, and Michael and I really, what we do every day is we educate. We educate clients on Medicare. And so, Michael, you've been with us for just shy of 3 years. And, you know, for the people here on the radio, you know, you as I'm going to call you a 20-year-old because you are. And I'm just going to ask you to sort of share a little bit about your experience in sort of finding this opportunity in this industry and finding your way 3 years later to have embraced it to the point that you have, which is so exciting for me, but I think also for you.
Absolutely, Mark. To give a little bit of history, so I applied for a support temporary position at Emerald Medicare back in 2020. I, at the time, was 22 years old, and it was the peak of the COVID-19 pandemic. And as a recent college graduate who did not have the opportunity to have a standard graduation with all of my classmates and go into the workforce at a time that, you know, was not in the midst of some very intense political, social, economic atmosphere, I was just applying for jobs, trying to find the next steps for my life. And this listing came up, and it seemed to highlight the strengths that I had. And I had no concrete expectations of what to picture with this role at this company. But as I got immersed into the world of Medicare and began supporting you and the team at Emerald Medicare, it became an industry that I became very familiar with, and with each day came a new learning experience. And now, fast forward 3 years later, I'm 25, I'll be 26 in October, and I just passed my New York State licensing exam. So I'm planning on continuing in this industry because I have learned to love it so much, equally as many of my other passions, and I'm just really fortunate to have had such a wonderful experience with Emerald Medicare and to help support our clients in each day with all of their Medicare needs. And it definitely was not something that I anticipated in the trajectory for my career path and my life, but 3 years later, I wouldn't have changed anything about it, and I'm very excited to see what the future holds.
Well, that's awesome, and thank you for that. And certainly coming out of the world of theater and the industry that is, I'm sort of curious, and maybe other people are, and whether you see any similarities or what differences there are in the work that you do for Emerald Medicare and the work that you're doing in your graduate degree and, the other area of passion in your life.
Absolutely. So I majored in both theater and business at Muhlenberg College, and business has always been something that I've really enjoyed in terms of organization and, coordinating, planning events, leadership. Those are topics in, classes in school that I was always very intrigued by, and I was happy to get my dual degree in undergrad. And, looking at where I'm at today, I'm currently in graduate school getting my Master of Fine Arts in Theater, Performance, and Vocal Studies because music has always been a passion of mine, and I've always done theater from a very young age. So going into that career path, I knew that there would need to be some sense of stability, not only artistically but financially as well. And that is really what prompted me to pursue the double degree in business and theater. So looking at both industries, as I'm, very involved, I go to the University of New Orleans for my graduate studies. And when I'm back in New York, I'm back on my full-time work schedule, but I'm supporting the team out there in New Orleans, on more of a part-time basis during the school academic year. But between the two industries, with Medicare, although each person's experience and each person's needs vary from situation to situation. In theater, there's a lot of versatility and direction that you can go when you're working on a project, and you have sort of this creative scope of possibility when you're working on a role or a performance. And in Medicare, I think a similarity is that each person is different, and each person needs something different when it comes to their coverage and what preferences they have. And talking with each client to kind of determine what structure of coverage works for them kind of has that same similar experience that I often have with theater, that, there's many possibilities and directions that you can go pertaining to the project at hand. But I also think that a difference is that, in terms of the Medicare enrollment process and evaluating what's best for each person and client, there is, at least at Emerald Medicare, a set of structures and a system in place where we're able to guide them hand in hand from the very beginning of the process, getting your red, white, and blue card, all the way through to any supplemental policies and, additional coverages that are needed, whether it's dental or prescription drug coverage. And that is very streamlined, whereas I think in the artistic process, it's a little bit different since, depending on the scope of the project, the lights, the sound, all of these factors, there's one of many different directions it can go. So, those are some similarities and differences that I definitely see between the artistic community and the industry and the Medicare industry.
So clearly the work that we do, and I think you'd agree, is really about education first. I don't actually consider us a sales organization. I consider ourselves really a customer support organization that initiates all interactions with clients to educate them. And I think that now that, and again, I want to tout the fact that you got your life and health license because that's no small achievement. You studied, 40, 60 hours in order to achieve that. And, now that you have your New York State license, you can really begin to expand to other states and get what's called a non-resident license. Certainly, likely the first non-resident license you would get would be in Louisiana, and then other states beyond that. And so for me, in my capacity as the one who is the director of Medicare for Emerald Medicare, I see that the growth that you've achieved in learning this business and being able to educate individuals and also talking to planners or medical office staff or other people has really been, I think, what you have seen is a tremendous opportunity, but also tremendous joy in the work that we do.
Definitely. Yeah, and I think that going through with the process and pursuing my New York license has definitely opened the door to a realm of possibilities with many other states. It's on the horizon for me to get my non-residency license in Louisiana. That's correct. And starting to see how with Emerald Medicare, we've really maximized some really substantial growth over the last few years. And, evaluating how my place in that can now open up a new region of the country is something that's very exciting for me, and I also think is very exciting for the team and the organization for Emerald Medicare. So, that's definitely right. I think that it was a long process. I had many hours of studying and practice exams, but, clearly it paid off, and I'm looking forward to see, what's next with that regard.
So, being remote, you got hired, around the COVID challenge, and then, graduate school was on your radar. And, for me, there was some hesitation around how a remote worker would work. And I know that is the new model, but I'm a little old-fashioned in that regard. But it has worked. And so for the purposes of the people on the show, it's not just remote as in 20 miles away where you can easily go into the office or, maybe a train ride away, but you are quite a distance away. And so how has sort of working, collaborating, an hour difference in times, how has that worked for you, and how supported do you feel as a part of a team that's, sort of working in a volume-based business?
Yeah, so I definitely missed when I'm in New Orleans the in-person interaction with my team and, to a degree, some clients, as every now and then we'll have some in-person meetings as well. And just being able to show face and ask questions in person, obviously, is a very different dynamic than working remote for the most part. So having that, piece in place where I can't just turn to a team member and say, hey, so-and-so is calling about this issue. Have you spoken to them? Or asking a question, to you or someone else on staff about a topic that, we want to make sure we give the correct advice and guidance to all of our clients. So that is definitely a challenge at times. However, I feel in the past few years, I have definitely learned enough and continue to commit to learning more where I can be as supportive to my team and to our clients as possible, even given a remote atmosphere, and I also think that with the pandemic, that kind of catapulted the world into this remote norm for work in many ways. And I think while it can definitely be convenient for many businesses, and it has for our business as well, I would say, in certain respects, that is definitely a challenge of not having the in-person interaction. But at the end of the day, working in a different time zone and working with a team that is very committed to excellence has done nothing short of, help our clients in the best ways possible,
And you've done a great job in really working through the model. It's, there have been, technology challenges that we all face, and then there have been, logistic problems just in terms of sharing a spreadsheet, for instance. But, we also have a person who is now involved with Emerald Medicare who is in North Carolina, and her name is Jackie Vogel. So
That's
for
right.
those folks on the phone, we are truly expanding. We have just under 2,000 clients. I'd say 80% are in the tri-state area, New York, New Jersey, Connecticut, which I travel often to, even these days. But certainly as people move and as opportunities come up for me to do speaking in other places around the country, we've expanded to other states, and now we have people who can sell, support, educate in other places. I'm actually heading to Indianapolis, Indiana, for a presentation on actually dental components within Medicare and outside of Medicare. You were with me in Atlanta, Georgia last August doing a presentation on how Medicare is different for everyone and how Medicare is the same for everyone. So
That's right.
We continue to travel and expand, and, it's nice to have, you here in New York during this time of the year. But it's also nice to know that you're still engaged in this business, even remotely.
Absolutely.
So when it comes to the kinds of questions that come up, what are some of the most common questions, Michael, that you hear from people who are really just trying to even just set up an appointment just to see if they like us, trust us, and want to work with us? Where does it all start from your standpoint, from when people call in and talk to and find Emerald Medicare?
Right. So I think that a common misconception in the Medicare industry is, many people hear a lot of buzz about, when you're turning 65 or retiring, that, you need to get your Medicare in place. And I think something that's very common in picking up the phones and talking to people who may be interested in speaking with you about their Medicare needs is that many people feel the need that they have to do something. They say, I'm turning 65. What do I need to do? How long do I have? And for many people who have their coverage through work or an employer, it actually is the case that you don't need to come off the company coverage until you're getting ready to retire. So it is often that I find people will call who are turning 65 and are happy with their group coverage and, having the response be, there actually is nothing you need to do at this time. And, of course, with more conversations down the line and checking that all of the factors, are in place, that's something that often comes up. I think another question that people ask a lot about is, what are some of the differences between Medicare Advantage and Medigap? And, again, that kind of goes back to a lot of the work that we do based on their preferences. If they want, no copays, or if they want, to see any doctor in the country, as we, are able to do when you're on a Medigap plan. And some of those nuances are things that our team has really worked hard from the research component to ensure are part of their conversations with you. And, as we continue to commit to looking up very important pieces of information, like, all of their doctors, checking that they're in network, and looking at prescription drug plans and how those costs compare to other plans that are recommended through Medicare.gov. These are very, very nuanced pieces to the puzzle. And I think our team has worked really hard to be as informed and to educate as much as possible, so that way each person feels they're making the right decision for themselves, with all of the resources that are possible to help them along the way. So, those are some things that come up as we're on the phone and talking to clients and prospects about, how their Medicare situation, as you mentioned, is the same or similar to many others, but how it is very different. So off the top of my head, those are some things that I find often come up in communicating with people about their Medicare needs.
Well, Michael, I think you hit it the nail on the head. I mean, those are really the top issues that come up. People are concerned about things like what I would consider rules, missteps, penalties, timing, right? Those are sort of the basic overarching challenges. And then once those issues are addressed and discussed and they sort of settle into being comfortable with how we're approaching the questions we're asking and sort of patiently listening to what their situation is, what kind of coverage they have, maybe how often they're using their doctors and the extent to which they need medications. That's where the rest of our work and our team's work comes in, with reviewing the doctors and the meds and sort of beginning the process of having a follow-up phone call where then we're talking about Advantage plans or Medigap plans, or in some cases even dual plans, which are Medicaid and Medicare plans that are combined. So I think I come back to, and I know that you heard me speak on this, is that Medicare is different for everyone and Medicare is the same for everyone. And I think that's what's good, is we have a general sense on how it's the same, and we can help them with rules and missteps and penalties and timing. But then it's different for everyone because people's doctors, meds, health, and budget are different.
Right.
So, again, I think that you have added tremendous value in communicating. Again, one of the things that as a communicator in theater and the experience that you have is you're a communicator. And being able to communicate and educate in the world of Medicare, I think is exceptionally helpful, and I think one of the things that you do best.
Thank you, Mark. I really appreciate that.
Yeah. So for the purposes of really the doctors and the meds, just talk a little bit about the importance of that and what we really do in that regard in your own words.
Right. So I think that, especially towards the open enrollment period, which, we are gearing up for, which is the one time of year that, people who are enrolled in the Medicare program can change their plan simply for preference-based reasons if they're not happy or if there's anything they want to adjust as the new plan information comes out for the following year. That's the time where, we see a large influx of business, as I'm sure many other Medicare organizations do across the country. But during the open enrollment period, that's when many people see commercials and hear radio advertisements about, you need to change your coverage, you need to do X, Y, and Z. And in those instances, we have seen before many, they're called bait and switch topics, where people will enroll in a plan and not necessarily check if their provider is a network. And then come January 1st, when they go to the doctor and they have a situation where they don't accept the plan that they've enrolled in, we want to make sure that situation doesn't happen. And part of the work we do with the doctors is, when we're looking at Medicare Advantage plans, we make sure based on zip code and various carriers such as United Healthcare, Aetna, and so forth, that the doctors that they see, if they're loyal to them, we want to make sure that they are in network and that they take the Medicare Advantage plans that we're evaluating for them. So, we have seen very long lists of doctors on the support side. We have seen, the occasional PCP, and that's about it. But us committing to making sure that your provider is in network, I think that just really goes back to the trust aspect, that with Emerald Medicare, we're doing a work that is very, sincere and transparent towards the people that we help in the work that we do. So when it comes to checking the doctors, we evaluate, make sure that everything is good. And then if there is an instance where, certain doctors are not covered, that kind of goes into, like you mentioned, the second or third follow-up call where, we say, well, this is the information that we found. What are your opinions on that? Are you loyal in seeing this doctor? And, from there, the conversations move forward about what coverage is going to be best for them. So in a nutshell, that's about, the work that we do. If there's anything, that you want to add, certainly feel free. But that would be my answer when it comes to...
So a few things. Open enrollment is October 15th through December 7th, folks. We are able to talk about plans for 2024 starting October 1st and not one day sooner. We can't actually help someone sign up for a plan for the new year, 2024, until October 15th. So it's a very short window, October 15th through December 7th, that we're actually engaged in helping people review their doctors, review their meds. Can they get more dental? Can they get more eyeglass coverage? Can they get acupuncture? Can they get gym membership? Gym membership is not utilized as much as I would think it would be, but gym membership is certainly important. And certain carriers have different plans that cover different gyms. So all these things are the kind of work that we do and we help people with. It is really important, I think, for people to know how to contact us. So it's 845-358-1220. It's emeraldmedicare.com. But on our website, not only will you see pictures of my staff, but you'll also be able to get a sense of the kind of work that we do. There are some videos on the site, and there are some videos on YouTube as well. And so we have a YouTube channel that has some of the radio shows on there from the two stations that I do have guests with. But there's also webinars that I've conducted that are on there that people can get a really full flavor, an hour-long presentation on a webinar that I've done through COVID. So there's so many ways to be educated in Medicare. Recently I was talking to a whole host of financial planners, and at one point they said to me, "So what makes you as a broker different than the other brokers that are out there doing the other work?" And before I actually even answered their question, they said to me, "What I hear from you, Mark, is that you're a 12-month company, and that the company isn't just you, Mark, that you have a team of people that are there, that if we have a question, we can get our questions answered. And this gives us the ability to grow. It gives us the ability to support all the clients that we have with a dedicated staff of people from really around the country who can really answer the phone and be a resource for people. If someone signs up directly through the carrier, they're not going to get that same person again. We truly have personal relationships with our clients. We know who they are. We understand their needs, and we're there to help. So, I want people to understand that what we have in a brokerage model for Medicare is very different. 845-358-1220, emeraldmedicare.com. Thank you, Michael, for being a part of the show. You were tremendous.
Thank you very much, Mark. You too.